Joining us now is Alex Azar, the Secretary of the Department of Health and Human Services. Secretary Azar, good morning, sir. Nice to have you with us.
So good to be with you, Savannah. Thanks for having me.
Well, we're watching this rollout in real time. As you just saw it live on air, this is the first day that Americans are going to actually get shots in the arm. I know you have a media event later where patients will get some shots. How many people do you expect to be vaccinated this week with this first batch?
So we are sending out 2.9 million doses of vaccine, and so that's really going to be up to our nation's governors and where we have sent the vaccine. But we hope we'll see as much of that used as humanly possible this week.
There are roughly 6 million Pfizer doses. It's a two-dose regimen. So, presumably about 3 million people from this first batch will be able to get vaccinated. You have said that you think we could get 20 million people vaccinated by the end of the year, which is in 2.5 weeks. Are you still sticking by that timeline? Is that possible?
I certainly hope so. We know we have vaccine available to get to 20 million people by the end of December, and then a total of 50 million by the end of January. And as Dr. Slaoui said, 100 million people by the end of March, but we'll actually have 100 million shots in arms by the end of February between first and second doses. Today's it's such a historic day as we hopefully see the light at the end of the tunnel of this horrible pandemic and the toll of human suffering that we have seen. And I'm just excited I'm going to get to see some frontline healthcare workers today as part of the planned George Washington Hospital vaccination and get to see them getting vaccinated, some of the first people in the country.
Yeah, I mean, obviously there is that priority, understandably, for frontline workers, for nursing home residents, the elderly with these pre-existing conditions. But I know a lot of people watching are thinking, okay, what about the rest of us? When is it going to be like the flu shot where you could go into your pharmacy and get the shot anytime you want it? How soon is that moment going to happen, do you think? Summer, late fall?
No. I think we could be seeing that by late February going into March. It really, again, is going to be up to our nation's governors. But with the Moderna and Pfizer vaccine, we'll have, as I said, as many as 100 shots in arms by the end of February. And if we get the Johnson & Johnson or AstraZeneca vaccine approved in January, when their data comes in, we'll have significant additional supplies. And again, late February, in the March time period, I think you'll start seeing much more like a flu vaccination campaign, people going into their Kroger, their CVS, their Walgreens.
The general population.
Walmart. Yeah.
Wow. Okay. Let's talk about vaccine skepticism. I just saw a poll that came out this morning from ABC News and Ipsos. It said actually that 88% of Americans were willing to get the vaccine, which is a higher number than I have seen before in polls. But it said 44% of them wanted to wait. Didn't want to get it right away. Should people wait?
Well, I would advise people to do what their governors say in terms of prioritization. Just as we are rolling out these historic levels of supplies of newly approved vaccine, by their nature, we're going to all be waiting a little bit for vaccine.
But let's say it's available to you. I mean, I think this is the scenario is you could get it. Should you get it right away if you're in line and your time is up?
Oh, I hope you will. This is a 94% effective vaccine. It's gone through every aspect of FDA process with integrity and transparent data. I know if you are recommended to get it and it's available for you, please do get it. Protect yourself and protect those around you, but please get the vaccine.
You just mentioned the integrity of the FDA process, and I have to ask you because you and other officials are out here really trying to persuade people this is safe. It's science that has dictated this. But just on Friday, the president was tweeting again and said, among other things, get the damn vaccines out now, Dr. Hahn, referring to the head of the FDA. Stop playing games and start saving lives. Does that just drive you nuts as somebody who's sitting there trying to say, no, it has nothing to do with politics. This is really about science?
Well, what I can assure you and the American people is we have called every ball and strike according to the process here, science, evidence, law. FDA actually at 7 a.m. that day announced that they had already communicated to Pfizer that they would be approving the vaccine, and I made the announcement we would be doing that. Everything has gone according to the normal FDA processes here. Career FDA scientists made the call, as they will on any vaccine or therapeutic, Savannah. And I will ensure the integrity of that process because the American people need to know these vaccines, these therapeutics are safe and effective through a regular, standard, transparent process that we use.
Well, before we let you go, it is a happy day in terms of vaccine, and our hats are off to the scientists who've worked so hard to reach this historic milestone. But we're about to cross another milestone. 300,000 American deaths later today. 1 in 5 hospitals in this country is at 90% capacity on its ICU beds. How difficult are these next few months going to be?
Well, Savannah, I'm actually glad you mentioned that, because while it is a historic and happy day in terms of the hope, it's also a call to action. We're in that bridging period. You got to act responsibly. Please wash your hands, watch your distance, wear your face coverings when you can't watch your distance, and really be careful of those indoor gatherings that are overcrowded where you let your guard down, because we've got these vaccines coming to you. I want you to be there to get these vaccines. I want you to be there. I want next year's Christmas and holidays. I want everyone in your family to be there. So please be careful over the next several weeks. Be very careful.
It's a critical moment. Mr. Secretary, thank you for your time this morning. We appreciate it.
Thank you.